Bob's right. Here we go, ladies and gentlemen.
Are we good?
We're good to go. Let's begin.
Okay. Thank you, everyone, for zooming in this morning. We'll have lots to talk about. The first item on the agenda is the approval of the minutes. Before we do that, I did meet with Claudia Weber and asked her about the minutes and content, et cetera. And she happens to love detail. So she can research, and if there are questions, she can dive back in and get the answers, this, that, and the other thing. So I think somewhere out there's a happy medium. I think we're getting closer to it. It was a 7 and 8 page minute, and now we're down to 3. It may be 4 or 5, whatever. I mean, it's just good to have all the cogent information in it. And thank you, Alyssa, for doing that. Are there any corrections or questions about the minutes?
Move to approve.
I do have one correction, that in the 4th paragraph, it's the J&J vaccine provides 3 times the antibodies. It's actually the J&J vaccine booster that they're doing. So the antibody level is 3 times after the initial vaccine. Minor detail. May I have a motion to approve?
After the correction, motion to approve.
Yeah, second.
All those in favor?
Okay.
Any not? Okay, so moved. Thank you. Reports. Jen, you're on.
Okay, well, as you guys know, our primary focus right now is vaccinations, and to date, we've done over 4,000 first doses, 1,800 second doses. Yesterday, we did 520. We were bored because we've gotten so good at it. So state did contact me yesterday, and we are getting 100% of our allocation next week. So we're getting 800 Moderna doses next week. We sent a link out this morning through Kevin's messaging. It's already filled. All 720 spots for next Thursday are filled within 45 minutes. So that's great news. And we're going to obviously continue as long as DPH gives us vaccine and as long as we have, arms to put doses in. So that's great news. And testing.
Jen, it's Tom. Have we had any group of people who are hesitant to get vaccines, or is it just the land rush to be first in line? What are you seeing? Any hesitancy in the population?
Not that I'm seeing. Everybody's beating down the door to get vaccinated as fast as possible. I mean, I have an extra dose list a mile long of people we call when we have extra doses, and we're also doing homebound visits now on Mondays. We've kind of been doing the homebound all along, but now the state has a formal process. So every week I get emails from the state of doing homebound. So kind of covering every, inch of the residents that we can. Also, the doctors in town help with stuff like that. So they do it. I'm sorry, the phone keeps ringing because it's the first day. So no, we do not have an issue with people saying they do not want to be vaccinated. No.
So Tom, there are probably sporadic people out there who have issues with it and are not being vaccinated. I saw 2 patients, for lack of another term, yesterday that came in with a myriad of questions, but they were there, so they did want to be vaccinated. They just had to be reassured. They each had some significant medical issues.
Right.
And we're concerned. And once again, we've said it each time, but the efficiency of the whole operation there is impressive. These people who are being vaccinated, they're called, they're greeted, they're escorted, they're signed in on the computer, they're ushered back to their stall, they're given the vaccine. They are then go into a room where they're checked again for the mandatory with first dose, 15 minutes of observation. Those that have allergy problems, we watch for a longer period of time, 30. Those that do have some kind of reaction, seemingly, even though they're very rare, are, watch for an hour or so. So it's in there, we're practicing everything, distancing, it's all it's all working very well, and the town is very appreciative of.
Well,
Here,
and when they contact us and they're hesitant, they do ask, is there a doctor? You know, I'm like, yes, our school medical director, Dr. Harrison Pierce. And then they're like, oh, Dr. Pierce, you know, Harrison's kind of a legend in New Canaan. So, I mean, they do, and they're all RNs that do the vaccinating. I mean, EMS helps on Thursdays, but I mean, they're all medical professionals. So people are, you know, really good, and they come, they ask their questions, they get everything answered, and people spend the time with them. Nobody's rushed out, you know, they have questions we do ask. Where was I? And then regarding the testing, we still have the testing full, still demand for that. Today's overfilled. With Waveney, we've done over 3,900 tests now. Combined with all the testing we've done in the past year, we've done over 10,000. So, I mean, it's pretty impressive when you start looking at the numbers of what our little itty bitty health department's done in the past year. And of course, with vaccinations, we couldn't do it without human services helping and all the other volunteers in town. You know, Bethany and Enza and Marcy have been a huge help to the health department through the vaccination. So that's been great. And Harrison, even though he leaves his stall, you know, has been phenomenal, staying there the whole time. So it's been great. I mean, doctors in town are volunteering. I mean, it's the outpouring of support has been tremendous. I mean, everybody loves it. Everybody loves the small town feel. And like I said, everybody greets them. Everybody's friendly and it's easy. You know, when you make something easy, people tend to do it more, you know, like testing. If you make it easy, they come and do it. If you make it difficult where they have to go stand in line for 4 hours, they tend not to want to do it. They don't want to deal with the hassle. So I think the convenience does help a lot of this. So I just want to thank Bethany and her team because they've been tremendous support. And Harrison, of course, for all your hours.
The legend, of course, comes from being around long enough. Not really positive or negative, but just being around. Okay, thank you, Jen. We do want to talk about where we are right now with COVID. It's two communications that I was on, well, one is Zoom and one an email. The Zoom was with the CEO of Yale Children's, and she was talking more about the Yale Hospital itself, where their numbers went from 200 down to 70, and now they're back up to 130. She is very concerned. She thinks the state reopened too early. The Yale people, like Dr. Fauci, they're concerned about the plateau of 50 to 60,000 new cases per day, and where that's going to lead the offshoot to our next surge. As a sidebar, she also talked something we're familiar with, the behavioral health issues and how the Yale whole young adult pediatric is overwhelmed with the numbers. They have 59 child and adolescent psychiatric beds up there. They're filled all the time. They keep 5 to 6 people waiting in the emergency room, sometimes 24, 48 hours till they can get a bed, can't send them home, et cetera. So that's a sidebar to this COVID deal. I did get an email from Dr. Orlanik, who's the chair of medicine at Norwalk, and he hasn't done this before, but he was very concerned about the numbers and what's going on in the community. So 40% of Connecticut is this B117, the British variant. And so they haven't had an upsurge in hospitalizations. They're also, he said, the youth is really being affected with this, and they are very sick. And for him to say very sick, it means very sick. They're being admitted to the hospital. So we're in the throes of this, and the little relaxation on the part of the state and everyone else too. Granted, there's COVID fatigue, but we have to continue to act as though we did early on with the initial outbreaks. And this goes for, be it local or be it traveling. Travelers have to mask all the time. They have to keep the distance. They have to, hand sanitation. They also, when you're on a plane too, wearing glasses or goggles or something like that is important, because these germs are spread through the air and they can enter via the conjunctiva. So this is, it's an issue. We're back to it. Dr. Orlanik was also just reiterating the fact that we've known where the vaccines are 95% effective. J&J, when they did their studies, it was in the 70s, and they thought that, the difference may have been the environment that J&J was being tested, which was much more, the disease was much more prevalent than what they were doing with Pfizer and Moderna early on. So they may not be 95, and even if it is, it's still 5%. And what Jen will attest to, we've had 3 or 4 people locally who've had been vaccinated and have gotten the disease, or at least tested positive, and it's happening in the community too. So we have to take all the precautions that we were taking previously and reinstitute them if we're not continuing with them. The travel issue is big, and you're going to have to, via the DPH CDC, you're going to have to quarantine for 7 days coming back and then have a negative test before you re-enter society.
Is that the rule in Connecticut now, Harrison, that people returning have to do that for 7 days?
It's not executive order. They refer to CDC, which CDC says that. There's no enforcement mechanism, but yes, that's what the guidelines are.
Right. Has there been, I haven't heard any stories or heard anything about children getting sick and being in the hospital. I would have thought that would have made the news. Is that something that's happening now?
Well, what happens when children get sick with it, they are sent to the children's hospitals, be it Yale or Columbia or whatever. Columbia came out with a study a few months ago of 150 children with this multi-system syndrome thing. So this is very life-threatening, just like COVID is. COVID-19 affects all of your systems, be it heart, lungs, brain, kidneys, etc. This multi-system disease with kids does the same thing. So yeah, and the whole thrust now with the more senior population, yes, being vaccinated, it helps, and also learning how to live with it and not being exposed. It hasn't really hit the same way with the younger population. By younger, I mean 20 to 45, 50. So it's a concern, and a lot of the transmission is within the family. To one establishment recently that called me about having questions where 2 people there reported positive, not related to each other, and they got it from the family. So that's by virtue of doing a little contact tracing. So it's an ongoing concern. Anything else? Any questions of
Thank you.
Jen or me on the topic, or Bethany?
I have a question.
Yes.
So I think in Brian Letsy's email, he mentioned that there was going to be a Pfizer clinics for high schoolers. Can they just wait with VAMs? They can just wait for the clinics?
That's not even confirmed with the state yet. There's only been discussions of that.
Oh, okay.
So there's no set date. There is no set anything. That they're just talking about that because of the problem with the 16 and 17-year-olds is they can only have the Pfizer. In most clinics, you don't know who has the Pfizer, and you can only go to, like Stanford Hospital or Walgreens. So we're the only health department that's done Pfizer. So we only did it that one time, but that is in discussion for early May. The state does not want to have that be a precedent before we do all the other group that are more susceptible to being hospitalized than a 16 or 17-year-old. So that is a discussion, but it's not anywhere near finalized.
Okay.
The only cities they're more finalized are in the middle of April: Bridgeport, Hartford, New Haven, Meriden, with the densely populated inner cities. The suburbs, they want to wait till May.
Okay.
Yale has an ongoing study with Pfizer dealing with children down to 12, and the results to date are very good, a very strong immune response. The hope is to have children immunized theoretically, I guess, by the time school sort of starts in the fall. So we will see if that happens or not, but that's the goal.
Thank you.
Bethany, Human Services.
Okay, everybody. Let me see. Good news is I am resuming the blood pressure clinics again at Lapham and Schoolhouse starting in May. At this point, we'll see what happens, but it looks like things are beginning to blossom. Human Services has assisted with the health department, and the vaccine clinics have been very successful. The response is and the feedback has been very positive. 98%, am I correct, Jen, of the 75 and plus have been vaccinated?
Yep.
Okay, so that's, as far as we're concerned, it's an incredible number. And
90 Wow.
98%. So the 2% are those that are unable to get it
Right.
for medical purposes or free will or whatever, but that 2%, we're going to let be. Let me see, third quarter data is out for Human Services, and we're going back to regular numbers in terms of food pantry clients. I mean, it's still an uptick, but not the tremendous influx that we've had. I think the stimulus checks have helped, as well as SNAP has maintained their increase in monthly food budgeting that they've been putting in onto the electronic benefit card. So as a result, and people have financially normalized, so we are seeing less of requests for monetary assistance, and also energy assistance was very, very positive this year from the state and federal agency. So we really, we're glad to see people are being a little more budget conscious. What we have seen as an uptick, and you'll talk, Jackie and Marcy will talk about, the referrals have increased with police and outreach with New Canaan EMS. So during that, I'm trying to think of the phenomenal, the New Canaan moms have been incredible, donating, as well as the churches and classrooms, all for the food pantry. It's such a great community experience from all different angles. That's really strong and going well. St. Mark's, is opening the church up more for donations, and everything just seems to be humming right now. I have we've really taken, because of the normalcy we've had, we've been able to be at the health of vaccine clinics to help out Jen and her team. And Marcy's been holding down not Marcy, Jackie's been holding down the fort here, and absolutely everything's running well. So, it's a pretty easy report this month and very positive.
Yeah, Bethany, Marcy, and Enza have been major help with that vaccination clinic.
It has created a wonderful outreach as well. Our outreach, we are not calling the 75 and plus, the 1,500 seniors. They were getting a little bit tired of us, I have to say. They're okay. So we really narrowed it down to those that really would like to have us in touch. But as a result of being at the clinic, that's been a huge outreach, and people knowing that we're there. So it's great. Thank you, Harrison.
Thank you, Bethany.
Yep.
Marcy?
Hi,
Adult
good
and
morning.
Senior Services?
As Bethany said, now that the seniors have all had their second doses, there's been a little downturn on needs for grocery shopping and pharmacy trips and that kind of thing. I am continuing to work with Adult Protective Services with some new vulnerable senior cases, and we have also gotten referrals, as Bethany said, from the police and the EMS and Staying Put, which has been great. It's really a nice collaboration. I'm thrilled that, the knee-jerk reaction is to call us because we can get services for residents, and we're really happy about that. And I'm looking forward to going back to Lapham. When that opens, I will start to show my face there and see all the seniors in a nice light rather than, panicked state. And that's about it this month.
Thank you, Marcy. Anything from the commission?
Harrison, what is the advice on if you have a whole bunch of people who've been fully vaccinated, and they're doing Zoom calls, is it safe for them to meet in person? Because
I think the advice coming out of the CDC in the state was within family, yes, or an individual thing if they have been vaccinated, fully vaccinated. As we see, to stretch it beyond that with larger groups, et cetera, there's some risk involved now with the variants and with this, what's happening, and knowing that we're only, 95% at best covered, and people who have been fully vaccinated getting this disease again. We know that what was happening last May, June, July, were people who had COVID were severely sick, hospitalized, oxygenated, et cetera. I'm not so sure the ventilation part, I can't counter that. But then they were back in the hospital 3 to 4 months later, and made national news with COVID again, having supposedly fully recovered. So there's just, ongoing questions with the disease. Being as safe as you can is the best way to do it. And, there's no guarantee when you're with other people that no one is communicable. So I know it's not an answer that anyone wants to hear, but I think there's the reality factor here.
Thank you.
Old business, nothing really to discuss. New business, thank you, Jim. Jim has sent us some emails regarding telehealth and also the long COVID and the repercussions of it that his daughter sent out of research from Mount Sinai, which, just kind of underlines this disease and some of the ongoing issues that people have. I did vaccinate a runner this week in the clinic, and he told me that he had this a year ago and how peculiar it was, just one case off maybe. He had a fever, didn't feel that well, was tested positive, lived in New York, but was fine after 2 days. 1 month later, he got the full-blown COVID, hospitalized, oxygen, et cetera. And he used to run 6 to 9 miles every other day. He's at the point now where he's doing 1 to 2 max. And this is, almost a year out. So it's, it's one of those long-term negative sequelae of the disease. Go ahead, Jim.
Unmuted.
You're muted now. Turn yourself back, it was better before. You're muted.
All right, got it. Thank you. Basically, again, telehealth is in the news a lot. The only good news, as I can always say, is that the only good news of COVID has been that telehealth has gone from a backbench technology that was always used by Mayo Clinic and Cleveland Clinic to service rural medical needs, and now it's a mainstream. So everybody saw the note, and particularly the opportunity is that telemedicine is the major part of telehealth that's been funded, because that's what Medicare and the health insurers have always paid for. However, the fact that it's now recognized, the technology is now recognized as part of the woodwork for medical care, wellness is only a step behind. And I'm not going to belabor the point right now, but I'm going to send some information out from this test that we ran on a 4-state basis of using telehealth. In fact, it's a direct parallel to what we do in New Canaan, but it was focused on low-income people and keeping them out of the emergency rooms and hospitalizations. And the amount of reduction because trying to think of how to say this in a politic way, but generally low-income people use a lot more emergency room and hospitalization for their medical care than the normal groups. You could reduce those trips to the ER by 30% and the rehospitalizations by 30% just with using telehealth for education and engagement. So we know that it works. It's only a matter of time before Medicare finally wakes up and the major healthcare insurers wake up to the opportunity, but it's coming, and I will send some information out over the next few weeks so that you continue to catch up. Last comment that I want to make is in talking to a New Canaanite who happened to be traveling through Kentucky yesterday. She said, you know, you're still involved in telehealth. I was listening on the radio. Amazon has a new program called Care Hub. That's a integration of all of the typical stuff we've been doing with telehealth here in New Canaan, but also includes Alexa and using voice actuated. Very interesting. And again, I will begin to send some information out, but Amazon, Apple, and Google are all working in this same space. And I want to see what and if that has any impact on the town of New Canaan. But we'll continue to watch because technology is moving in rapidly into healthcare as both the quality of health and cost improvement. So with that, I will bow out. Thank you.
What is, not just a question, Harrison, you, I'm sure, are in touch with your colleagues who still are in active practice. To what extent have they seen a shift towards telehealth care among their patients? Is it a handful, or is it the 20-30% of their total day now on a screen rather than in person? What are they saying?
Well, reported the Yale CI, the Yale CEO whom I referenced before was talking about the children. He said now the pediatricians up there is 20% telehealth, which is a big jump from what it was. Yes, the internists and pediatricians were doing telehealth quite a bit, but this is where they didn't want to be exposed. And the people who were potential carriers didn't want to expose them either. So more was being done over via telehealth as well as the phone. The thing about telehealth that's good, you have to, put all of the data in it versus the telephone, which data does not get recorded. So it can get a little problematic further down the line. Telehealth is more helpful and feels like psychiatry.
Yeah.
They use it a lot with autistic kids via the Yale channels, the Yale Child Study Center, because sometimes it's just problematic getting an autistic child into an environment like that, where they're very uncomfortable, and it sets off all sorts of behavioral reverberations. I think there's based on my experience in the past, there's a problem with telehealth moving forward. And I referenced to one of our meetings about a local malpractice lawyer. She defends physicians, and she goes around and she's been speaking to the hospitals as well as medical groups. They're concerned about telehealth. And when you look at Jim's data, which out of the Wall Street Journal, which was very good, one of the continued barriers is liability, and it had a 33 rating there, 33%. It's certain diseases, you really need your eyes, your ears, a stethoscope, and the tools to do it. And when you start doing this over the phone, the risk incrementally increases. So there are going to be certain, acute disease has to be seen in person. Some of the more chronic follow-up and some of the psychiatric things are good. And there's such a shortage of, as we know, of the psychologic care. To have this be available on telehealth is, I think, a great thing for lots of people. And also for people who don't need the acute evaluation, but because of mobility and transportation, this, that, and the other thing, are, it's a significant help for them.
As a wellness education device, again, it's not been, that's in direct parallel to the amount of reimbursement coming from the health insurers, particularly Medicare. And so as it takes on medical credibility, and as you point out, Harrison, it does vary. And that's what the Wall Street Journal thing was interesting in, that it does vary by practice and by particular need. Wellness, generic and general need, but in point of fact, it has evidence in this four-state thing that I was involved in is absolute proof that you can impact medical care and the cost of medical care with an ongoing education that's very simple and very inexpensive. So it's something to watch. We're not quite ready to roll it out yet, but I would suggest if you have time to Google Care Hub and take a look at what Amazon is doing. It's well written up at this point. Thank you.
Yeah,
Yeah, one thing you mentioned, Jim, about, excuse me, Russ, about inner city people and being frequent visitors of the emergency room, et cetera. The reason for that is they don't have physicians. There's no one
Yes.
else to call. The hospital and the ER becomes their physician. So that's, and even though with increases in Medicaid reimbursement and Medicare too, and sometimes in the psychiatric realm also as a sidebar, the government pays better than the private insurance companies in that psychiatric domain.
Yeah.
But that's one of the issues, serving the inner city population and having the personnel, et cetera.
Yeah. Last time I looked, which was a couple of years ago now, the cost of unreimbursed healthcare in the emergency room for Stanford Hospital was $23 million a year. And I'm sure it's more than that now. So that's a big cost containment and quality issue with the hospitals. Anyway, stay tuned. The technology is coming. And again, the only good news from COVID is that telehealth has made a major stride forward.
I would just add one population. We've added telemedicine, telehealth to the offerings for our employees. And the utilization over the last year has gone up about 40%. Tom, to your point, but we're talking about working mothers. We're talking about single mothers. We're talking about first-time parents. And they absolutely love the technology. They hated being told that there was a 2-week delay before they could come in and actually see someone. So you saw the emergency room visits start to spike. So there is another age cohort and group there of working parents who are finding it very, very helpful and very useful for their children, but also for them. So we've seen a dramatic increase in the utilization, which has brought down, as we are self-insured, has brought down our ED costs significantly. So as we manage cost over the last 3 years, we've actually, our cost, even though our system has grown dramatically, has remained flat. And telemedicine has helped dramatically in keeping those costs in line.
Thank you, Russ. Anyone else want to say anything? We're
Other than thank our staff again. I'm a bit of a broken record, but I think they deserve frequent and lavish praise for their hard work and dedication. So thank you all.
Yeah, we second that. It's been great.
Question, Harrison.
Yes.
From a standpoint that we have this massive amount of information that Bethany is put out, I'm interested in two things. One, the source of all that data that is now published is fantastic. The second thing is with Let's Talk About It underway and a lot of news of mental health, behavioral health as an issue, are we seeing any spike or increase, maybe a simpler word, with customers, citizens calling in with behavioral based issues?
I think, Jackie, you want to answer that?
I mean, in terms of the kids, definitely funny that we were offering that referral information, because when we thought about our data, we have our regular clients that are utilizing our food pantry and they call us when they have needs and need therapists all the time. But when we looked at the numbers, we're like, we do a lot of referral calls for the PD, for EMS, the churches, and it could be a host of issues. People are homeless, but then they have other issues. So yeah, and I think I was able to, it was 20 calls just in the month of March. For myself, I just got one this morning and there's one on my voicemail. But anyway, but yeah, funny enough, we did a blog we have a 30 Days of Family initiative that's for the month of April, and New Canaan Cares is going to house that. And blog that we were writing, it's a mom on the board of a Live Girl. She had this great information in this blog that will be posted on the New Canaan Cares site. But she said just in 2020 alone, mental health issues for kids under 17, for the age bracket of 5 to 11, those emergency room visits rose 24%, and for 12 to 17, they rose 31%. So, I mean, that's huge. And if you think about COVID also was, we were responding to that, but I think, these kids are really struggling. And I mean, I can speak to that. I did listen to a Zoom last night on gaming, and like everyone's probably frustrated with, and if they have kids in their home, even adults on their phones, on their devices, we're saying like, more than 3 hours, like a day. And I mean, think about that. That's a lot of time. That's like, it's bordering on having a substance abuse or gambling issue. And think about even adults. And I think they were talking about adults need to be the ones modeling to the kids, like, I'm not going to do it for work. And that's really hard to do because a lot of parents are working remote, or kids have stayed remote. So it was just interesting. And then the other interesting thing to that is if your child is on their device, maybe even less than an hour, that could suggest mental health issues as well, to say they're not connected. They're not, so they're missing out on sort of that piece. So that's interesting too. So just to know, we should only do about 2 hours, I would say, to keep it safe. But no, but Jim, I definitely know that when I give out referrals for therapists, people have to come back to me because therapists aren't available. They're so busy with telehealth. Some of them will be helpful to write it on their websites, like not accepting clients. So then we can move on, because that takes a lot of time to call someone, see when they call you back, see if they have availability. Maybe they don't return calls during their business day. So really, if someone's in a crisis, they need to see someone, quickly, as we all know. But yeah, I definitely think, but anecdotally, I don't have like what therapists, like what's being utilized. I know that agencies like domestic violence crisis centers are saying people are reaching out to them before utilizing police. So hope that was answered some of your question.
It's definitely on the rise. And again, it's a wonderful use of the phone and the computer. And most importantly, though, having a person in the process is critical. My last question is on the kids. And when you mentioned of a professional psychiatrist, psychologist not being maybe immediately available when there's an emergency, is Kids in Crisis able to fill that gap, or are they over?
It would be more for New Canaan strictly. It would be child guidance. So they have like a mobile crisis. So there are 211, like who you'd call. The schools utilize them if a kid's having, suicidal ideation at school or any type of, they come out, they do an assessment. They would be who we'd utilize. And I think Bethany has passed along. Now that includes adults as well. I think it's like the access line that you would also call 211 if you had an adult that also needed that help, which is great because, as you've said, we've seen rises in adults needing that help. Kids have always gotten it, but so Kids in Crisis can be utilized. They have an outreach line. They're all trained counselors. They're 24 hours. If a family or a student had an issue, with a family family issue, I mean, that wouldn't matter, but they wouldn't function in the way. And they can actually, with COVID, I don't know, they used to do outreach. They wouldn't go to people's homes, but they could meet at a police department so they could definitely, but they wouldn't do that like mental health part of it. Like child guidance could actually take that child on to do the counseling if they, or find them someone. But yeah, so that would be the organization that would help.
Thank you.
Welcome.
Okay, I think we're coming to an end. Thank you for your attendance. Enjoy the holiday. And may I have a motion to adjourn, please? Our next meeting will be May 6th.
Motion to adjourn.
Second.
Thank you, Russ.
Thank you.
Second, all in favor?
Yay.
Have a
Stay
good one.
healthy.
Take
Thank
care.
you, everyone.
Bye-bye.
Take care, everyone. I'm going to stop recording now.
Thank you, Bethany.
You're welcome.
Bethany, happy Easter, everyone.
To
Happy
everybody
Easter.
too.